When it comes to type 2 diabetes, there is definitely one therapy that is greatly underutilized that has great effectiveness. And we're going to be discussing that today. Stay tuned. Hello, my name is Dr. Brandon Pettke with Lone Star Progressive Medicine. Type 2 diabetes is one of the biggest costs in our healthcare system. There's so many, not only the management of type 2 diabetes, but the complications that come with it when we're talking about heart disease or we're talking about kidney dysfunction and kidney failure. And actually, most people don't realize it, but the number one cause of blindness in this country is diabetes, a complication from diabetes. Also, the number one cause of kidney failure is diabetes. Also, the number one cause of amputation in this country is type 2 diabetes. It's crazy how much it can affect somebody's life, and it is absolutely rampant, and we keep looking at the statistics. It keeps going up and up and up, the rates, and people are getting type 2 diabetes younger and younger and younger. And it doesn't have to be that way. There is definitely one therapy that is totally underutilized that needs a lot more attention and can certainly help you, and I'm going to discuss that right now. What is that? That is diet. I know it sounds simple, but I'm telling you, we have had some massive changes in patients that have type 2 diabetes, specifically on our weight loss program. A lot of times people come into our weight loss program and they have type 2 diabetes when we take their history. And so what we do is we're helping them lose weight, but really, as I tell all patients, my focus is to help you get healthy. If I can help your body get healthy, the weight's going to take care of itself, or the type 2 diabetics are going to change their blood values and everything else. We routinely, I'm not kidding you, when I have type 2 diabetics and they've gone back to their primary care or their endocrinologist, I've heard this so many times, it's unbelievable. They literally come back and they say, they redid my blood work, and guess what? My doctor, his jaw was dropped. He couldn't believe how much I had improved. And he said, whatever you're doing, keep doing it. And what we're doing is we're taking a functional nutritional approach to diabetes or to their condition. We're not treating diabetes specifically, we're just trying to get their body healthy. And by doing that, it's making massive changes in their diabetes. So what do? We focus on multiple different things. It's a multi-pronged approach that we take with our weight loss patients who happen to be diabetic. But one of the biggest things that I would say that is key is what you actually put in your mouth in terms of food. And so we focus on two things with the food. We focus on foods that are anti-inflammatory and foods that are low glycemic. And I would probably say more so than the anti-inflammatory, the low glycemic is super important for those who are type 2 diabetics because it's that dysregulation of the hormone insulin in the body that type 2 diabetics have a hard time dealing with. And so what happens is type 2 diabetics over the years have become what's called insulin resistant, which basically means they don't utilize insulin the same as somebody that's healthy. What they need to become is they need to become more insulin sensitive, all right? So what affects and what causes insulin dysfunction and insulin resistance is this overutilization of high glycemic foods. And so what they do is they spike up blood sugar, which spikes up insulin. And if you keep spiking up insulin over and over and over again, it's like screaming to your body. Your body doesn't want to hear it and kind of shuts off its systems to not utilize it. And so when it does that, it now insulin, instead of taking and driving sugar into blood glucose into muscles, it drives it into fat and it stores it as fat. So you'll see a tendency to have weight gain with those who are type 2 diabetics. So that's why our weight loss is very effective, but it's also why we're very effective at changing some of the blood work when the patients go back to their doctor, is because we basically take them and we can bring them down to where they're so insulin resistant, we can bring them down to where they're more insulin sensitive. And what that does is that lowers their A1Cs. I mean, literally most recent patient, not gonna say her name, but literally about 70 days ago, her A1C was a 9.0. She was told she's diabetic, she needed to go on medication, so forth and so on. She said, I really don't want to. What I want to do is I want to try to change some of my lifestyle habits. And so she came into the clinic. She actually started on a weight loss program. Literally like 70 days later, she went back and had her blood work done. Her A1C had dropped from 9.0 to 6.3 without any medications. That is huge. If you're a diabetic and you're listening to this, you're like, what? I mean, I can tell you story after story within a 90-day time period where more more than a point and a half, 2 points have been dropped in their A1C. Their fasting blood glucose numbers are under 110, under 100. They're able to get off medications. Some are even able to get off their medications altogether besides just reducing them. So it's been absolutely amazing. So those diabetics, they need to focus on low glycemic foods. If you need help with that, oh man, I'd love to help you. It's definitely a passion of mine. It's definitely something I would love to and honored to help you with. So anyway, you can find out more about our program if you're interested in on our website. If you want to meet with us at the clinic, we'd be happy to meet with you and see how we can help you. If you think this information is useful, please share it with somebody. If you know somebody that's suffering with type 2 diabetes, I hope it can be useful for them and they can utilize it and apply it into their own life. But anyway, I hope you have a wonderful day, and I hope, like I said, this was useful. Hope you take care.